We are desperately worried about the number of people who are not receiving the treatment and care that they need, and of course, deeply saddened by the loss of life during the last 2 years.
230 patients a week are dying needlessly of heart problems, according to the British Heart Foundation. The charity says that there have been 30,000 extra deaths due to heart disease since the start of the pandemic. Charity worker Phil Moore had a very unexpected heart attack and experienced a longer than expected wait for help after calling 999. He told Anna Cunningham on Early Breakfast that he started to feel very ill and then waited 40 minutes for an ambulance.
Immediately called 999. Even at that point, I was thinking I was having a heart attack, but I didn't even want to risk and just go, let's just get an ambulance here as soon as possible. And if it goes away, great. But if it continues getting worse, then I know the paramedics were at least en route. I was falling in and out of consciousness, so I really did lose track of time. And it was very hazy. It was kind of like going a bit into a dream and then coming back out. And I realized what was happening. And at that point, I looked at my phone at one point and realized it was 20 minutes had passed. And then I realized that was too long. I didn't know what the time was. I kind of had it in my head. There'd probably be about 10 minutes, maybe 15 minutes. But I heard no sirens in the distance. I heard nothing. So I called again. I think during the actual call, and I cannot recollect for sure, but I think during that call, I was starting to get very lightheaded again and starting to sort of ease in and out. So while I was talking, I just kept stressing how important it was. They needed an ambulance there and then. I knew that the longer this was happening, the lower my chances of survival would be.
Yeah, that's Philip Moore there. Let's speak to Dr. Charmaine Griffiths, CEO at the British Heart Foundation. Good morning to Charmaine.
Good morning. Lovely to be here.
So this is really difficult for many people to hear because they feel if they do have a heart attack, that they'd like to believe they can get to hospital and get better, and this is a big worry. But let's look at the big picture first of all. 30,000 extra deaths due to heart disease since the start of the pandemic. Is there sort of two phases of this, what it was like during the pandemic and what it's like with the backlog after the pandemic?
So do you know what the picture is? Just really, enormously pressured, obviously through the pandemic, but even still now, we're seeing just unprecedented pressures. And as we've just heard from Phil, we wish Phil's story was unusual, and it's not. We are desperately worried about the number of people who are not receiving the treatment and care that they need, and of course, deeply saddened by the loss of life during the last 2 years. As you said, we think there are 230 people every week who are losing their lives needlessly because they're not getting the treatment and care that they need. Do you know what? Before the pandemic, things were already tough. The NHS was already overstretched and already struggling to meet best practice targets, such as the 18-minute response time for heart attacks and strokes. But things have absolutely gotten to a crisis situation where we are calling urgently for action to support both those people who are having heart attacks and strokes today, but also to look after the progress we need for people longer term as well.
So are we saying that 5 years ago, this 230 people wouldn't have died who would die this week because they can't get care for a heart attack promptly enough?
So using official statistics, we know that there have been 30,000 excess deaths, so additional deaths linked to heart disease than there would have been prior to the pandemic. And that's using data from all of the OHID and NHS England sources. And we know that's happening despite the very best efforts of everybody in the healthcare system and ambulance trusts. But as we've all heard in headlines across the months and years as we've worked through this pandemic, the situation isn't getting better, and it isn't getting better quickly enough for people like Phil and those 230 people this week who will lose their life. And that's why we're calling on government to set up a national heart strategy that pulls together all the brilliant work that's already been doing, but helps us tackle absolutely urgent needs, such as making sure we've got enough workforce and enough specialist care and support, as well as enough preventative measures in place to help people stay well during this period. So we're absolutely calling on this new government, as it sets up its healthcare priorities, to establish a national heart strategy that gets us back on track as we recover from the pandemic, but also means that we don't miss out on the millions of people with undiagnosed risks such as high blood pressure that are just going to stack up problems with heart attack and strokes for the future.
And what's the advice now? That if people think they're having a heart attack, they should of course call 999. Is there quite a soon point where you should get someone, if you're lucky enough to be with someone who's got a car, get in a car and get to hospital? Is there a point where you have to say, I'm not willing to wait any longer for an ambulance?
Anyone experiencing heart attack symptoms or stroke symptoms should call 999. There is no better advice we can give you today, and the NHS would say the same thing. What we're calling for today is a national heart strategy that pulls together all the pieces that are required to make sure we get to a better place for people like Phil in the short term, and also look after all of those people who are getting worse because they're in the waiting list for treatment.
But ultimately, what you're saying is there's nothing you can do now. So if I were to have a heart attack tomorrow, I've got to hope that the ambulance service works well enough where I am, and it's a postcard lottery, because if it doesn't, I could be in trouble.
Do you know, no one's doubting, as we've heard from Phil, the pressures and that the system is under, but the best advice you can absolutely do if you or a loved one is experiencing heart attack or stroke symptoms is call 999. There's no better thing to do.
And just before you go, Charmaine, what are this? I know that the men and women have different starting symptoms of a heart attack. Are there a couple that you could point to that are clear heart attack symptoms for men and women?
So you can find out plenty more about this on our website, bhf.org.uk, and symptoms do vary from person to person and between genders, as you've rightly said. Obviously, symptoms such as chest pain, breathlessness, and radiating pain can be classical symptoms. But we would say trust yourself, as well when you're not right. And we'd much rather have the call and there are experts there, of course, to help you than run the risk of having a heart attack and not seeking help when every minute, of course, counts.
Every minute counts, but it might take 40 minutes for people to get to you at the moment, as you're pointing out. Dr. Charmaine Griffiths, great to speak to you. Thank you for joining us.
Thank you.
She is the CEO at the British Heart Foundation. You can look at symptoms, as she was saying, at its website, the BHF website. Go and see them now if you're concerned.